Now the latest on Ebola. The CDC says it's doubling down on its response training after a nurse in Dallas got sick. 26-year-old Nina Pham was on the team that treated Ebola patient Thomas Duncan. She wore full protective gear, but the CDC says somewhere along the line she messed up.
At some point, there was a breach in protocol, and that breach in protocol resulted in this infection.
Well, Christin Ayers says that comment infuriated nurses across the country.
Nurses in that hospital were very angry about the fact that one of their colleagues was being blamed for a situation where she had no control.
The nurses that Union Rep Roseanne DeMoro is talking about claim to be colleagues of Nina Pham's.
We promised them that we would protect their anonymity and we would protect their families, and that's what we intend to do.
So National Nurses United held an unusual press conference at their Oakland headquarters. The nurses identifying themselves as Pham's co-workers listened in and sent answers to reporters' questions by text.
These nurses are in fear of their livelihood. They're in fear of their ability to remain at that hospital, and so they're trying to protect them and their families.
Their stories told through union reps paint a chaotic picture of how Texas Health Presbyterian Hospital handled Thomas Duncan, the first person to die of Ebola on U.S. soil.
There were no protective gear. There was no gowns that were adequate to properly treat Mr. Duncan. There were no adequate masks and face shields to protect the nurses and other healthcare workers. He was not put into an isolation room for several hours.
Initially, what was said is that these nurses weren't following protocol. What the nurses are saying, there were no protocols.